Chapter 5: Psychosocial and Functional Considerations. When teens and their families first hear the word scoliosis, many fixate on how a curved spine looks in the mirror or on an X-ray, and it is easy to assume that any operation promising a straighter silhouette must automatically bring a better life. Yet the psychosocial and functional research tells a far more complicated story, showing that cosmetic relief can come at the cost of chronic pain, activity limits, and mental health struggles that linger long after the surgical scar has healed. Surgeons often point to radiographic success, pictures that reveal a neatly aligned rod and a curve reduced from, say, 50 degrees to 15, as proof that a procedure has worked. But studies repeatedly show that a straight line on film does not guarantee that the person attached to that spine feels better, moves better, or smiles more. In fact, the 2008 systematic review by Weiss and Goodall gathered dozens of reports and underscored a key point many practitioners still overlook. Patient satisfaction hinges on daily comfort, the freedom to play sports, the ability to sleep through the night, and confidence in one's own body, far more than on any single post-operative angle. Within their survey of outcomes, the authors highlighted cases in which young people who achieved textbook-perfect corrections nonetheless reported lingering back pain, stiffness that made tying shoes or bending in gym class difficult, and an unexpected sense of fragility that shadowed every jump, twist, or dance move. One girl quoted in the review said she felt like a china doll with a metal spine, proud that her ribs looked even when she stood in front of friends, but anxious every time she stepped onto a trampoline, wondering if a hard bounce might snap a screw. Another teen celebrated the first post-op image her surgeon praised. "Look, nearly 25 degrees of straightening," only to discover months later that her favorite sport, competitive swimming, now left her exhausted and sore because her upper back refused to twist the way it once did, forcing her to change strokes and eventually quit the team. For some, the pain shows up later, as hardware wears or nearby joints take on extra stress. Weiss and Goodall noted that reoperation rates climb with time, and each trip back to the operating room brings fresh anxiety, school absences, and financial strain on families. Beyond physical aches, repeated surgeries can chip away at mental health. Missing school events, worrying about infection, and living with uncertainty about future complications can fuel anxiety or depressive symptoms, especially in adolescents who already face the normal challenges of body image and peer acceptance. The review cites examples of teens who described feeling fixed but fragile, staring at flawless radiographs while grappling with a hidden fear that any fall might break a treasured correction, leading them to skip roller coasters, avoid roughhousing with siblings, or refuse invitations to try out for sports teams. At the same time, some who avoided surgery kept their original curves, yet enjoyed full participation in dance, soccer, or band, reporting higher overall life satisfaction even though their backs looked uneven on film. Such stories reveal a crucial truth. The human experience of scoliosis is multidimensional, blending self-esteem, social belonging, pain levels, and functional ability into a single tapestry that cannot be measured by Cobb angles alone. When doctors chase perfect radiographs without equal attention to these softer metrics, they risk trading a visible curve for invisible scars on a young person's sense of freedom and joy. Weiss and Goodall warn that the current literature often underreports late-stage problems, meaning that parents who sign consent forms may not hear the full range of possible long-term outcomes, from adjacent segment degeneration that can trigger new pain decades later, to the subtle but steady emotional drain of always wondering whether the next growth spurt or sports season will demand another fusion extension. At the same time, cosmetic gain, while real, may not fully erase self-consciousness. Several participants in the review admired their smoother backs, yet still felt uneasy in changing rooms because of noticeable scars or the stiffness they showed when bending to pick up a backpack. The takeaway is clear. True success must balance the outside view with the inside reality, valuing comfort, capability, and mental calm as much as a picture-perfect spine. For families weighing options, this means asking hard questions about life after the first year. Will my child be allowed to twist, flip, or stretch like peers? How often do former patients need pain medicine for sore muscles above and below the fusion? What is the average time lost from school and favorite hobbies during recovery? And perhaps most important, can we achieve acceptable appearance and better function through modern, non-surgical therapies before choosing an operation that cannot be undone? The research suggests that honest answers to these questions, grounded in long-term data and patient voices, lead to decisions that truly protect both body and spirit. Ultimately, radiographic success is only one slice of the scoliosis story. Lasting satisfaction grows from a spine and a life that can move freely, hurt less, and feel authentically whole, no matter what any X-ray shows.